Tamsin, the argument here today is when you do not have adequate staffing levels at area hospitals, it is, as you mentioned, the patients who suffer. Their lives are even at risk. In the past few months, we've seen New York City nurses rally, and today, Westchester County nurses are taking up the fight.
I bring attention to the short staffing every day to the management here.
But Nurses Union Rep Jane Comisa says things aren't changing at Westchester Medical Center, and when there are not enough nurses, the patients suffer. For some patients, it's life or death. Westchester Medical Center is the only Level 1 trauma center in the Hudson Valley. Corinne Noonan works in the trauma unit.
And yes, we work short often, unfortunately.
This rally for safe staffing levels is not the first in our region. Earlier this year, nurses from both public and private New York City hospitals protested, complaining hospitals were skimping on staff to save money. So now nurses are looking to the state to solve the problem. There's currently legislation in the Senate and Assembly that would mandate nurse staffing levels in New York hospitals. It has bipartisan support, but likely won't be voted on until 2020.
Enough's enough. Time, no more time for excuses, for smokescreen, for delays. Let's just bring it to the floor. Let's bring it to a vote. The votes are there. Let's pass it.
I reached out to Westchester County Medical Center multiple times to get their comment on these nurses' concerns. They did not respond. I should also point out that the New York City nurses that have been protesting, it was during contract disputes. They're nurses out here today and their union, they say there is no contract dispute. They just want more nurses on the job for safer staffing. We're live in Valhalla, Westchester County tonight. Allison Caden, Pix 11.